All right, April, thank you. The med spa industry is booming as people chase wrinkle-free foreheads and perfectly plump lips.
But there is a dark side to the industry that could put you at risk. That's why we're talking about it. And On Your Side, Susan Campbell is here to explain.
Yeah, and we're not just talking about kind of that botched Botox that looks a little funky. There are actual dangers here with serious concerns about unlicensed injectors and counterfeit Botox and other counterfeit fillers.
See where my mouth is like projecting out?
Andrea Blake couldn't believe her filler fail.
I came out looking like Marge Simpson. It was so bad.
Andrea is Southwest Sampler on social media. Because of a hosting gig, she scheduled a last-minute appointment for lip filler with someone she says she didn't vet very carefully.
We're kayaking down Horseshoe Bend. We're skydiving, and the whole time my lip is just flapping in the wind. So it was just not cute. It was really embarrassing.
Scroll through social media, you'll see all kinds of similar stories.
We all like a bargain, but aesthetic treatments for your face are not the time to be bargain shopping.
Here's why. You could end up with an unlicensed provider, counterfeit products, or both. In New York, an esthetician is facing charges accused of knowingly injecting clients with fake Botox he bought from China. And recently, police in Florida arrested a person posing as a doctor doing injections out of a backyard shed med spa. Police say the suspect botched a Botox injection and caused facial paralysis in one victim.
A lot of times you'll see these unlicensed providers saying something like, oh, there's no risk, which should be a huge red flag, because anytime we do any medical or aesthetic procedure, there is some sort of inherent risk.
So before you book, ask about recent education and check your provider's license.
Nurse, doctor, PA, nurse practitioner, dentist. So what you can do is once you find out what that person's licensure is, you can actually go onto the governing board's website. So for me, it's the Arizona Board of Nursing. Look up my name and see that I have a valid license to practice in Arizona.
You can also ask to see the Botox or filler your provider plans to use.
You'll also want to look for lot numbers, and this goes for any of the toxins. There will be a lot number and an expiration date on the box that matches the vial. There will also be holograms on the bottle itself. One dead giveaway that you are getting product that's counterfeit, not FDA approved for use in the US, is that it would have writing on it that's not English.
You can tell that my bottom lip is aligned with my upper lip.
Andrea had to wait several weeks to dissolve her filler fail.
We did refill your lips.
And she found the right person to help her safely get back to the natural look she loves. The FDA and CDC have investigated several cases of counterfeit Botox. In one case, 13 people were hospitalized because of harmful reactions. So the CDC says symptoms of botulism include blurred or double vision, drooping eyelids, difficulty swallowing, and muscle weakness. If you do have a reaction like that after any sort of injection, it is important to contact your healthcare provider or go to the ER immediately.
Okay.
Okay. Thank you for that
Susan,
warning.
Thank you.